You raise your arm to wave at someone across the street, and the skin on the back of your upper arm keeps swinging on its own like it got a separate invitation to the party. That loose jiggly tissue on the back of your arm is not just an aesthetic annoyance. It is a clinical signal. Your body is telling you something is going wrong underneath the surface, and if you ignore it, the problem will not stay in your arms. It will spread. I've been practicing medicine for 15 years, and I can tell you right now, most of what you've been told about this problem is flat out wrong. It is not about being overweight. It is not inevitable aging, and it is absolutely not something you need to spend thousands of dollars fixing in a clinic. What you are actually looking at is a connective tissue breakdown combined with a sluggish fluid buildup under the skin, and you can begin reversing it in 5 minutes a day starting today. The healthcare industry does not profit from you solving this at home. Clinics, cosmetic centers, and device companies make their money when you stay confused, stay insecure, and keep booking expensive procedures that do nothing about the real cause. I'm not going to let that happen to you. Subscribe to Dr. Waterling and hit like. We're working toward 100,000 subscribers, and every one of you makes this channel stronger. Let's talk about what is actually happening inside the tissue in plain language. No medical school lecture required. Your skin is not just one layer. Think of it as a layered stack. The skin itself on the outside, then a layer called subcutaneous fat. That simply means the fat sitting just underneath your skin. And beneath that, a thin but critical sheet of tissue called the superficial fascia. Fascia is basically the body's internal wrapping material. It holds everything in place and allows layers to glide smoothly against each other. When these layers are healthy and well supplied with blood, they stay mobile, supple, and firm. But when blood circulation in a specific area becomes chronically poor, meaning consistently sluggish over months and years, these layers stop sliding. They start sticking together. The medical term for that sticking and thickening is fibrosis. Fibrosis simply means scar-like tissue buildup that makes soft structures rigid and immobile when they should be loose and fluid. The back of the upper arm is one of the most neglected movement zones in the entire human body. Think about your daily life. You flex your arm constantly. You pick things up, carry bags, hold your phone, reach forward. But the muscle running along the back of the upper arm, called the triceps, the extensor muscle that straightens your elbow, barely gets used in normal daily activity. Extensor simply means a muscle that opens or straightens a joint as opposed to a flexor which closes it. Because the triceps and the surrounding tissue on the posterior arm, posterior just means the backside, sit in this movement dead zone, the microscopic circulation there becomes stagnant. Capillaries are the tiny blood vessels at the very end of the circulatory system, the finest branches that deliver oxygen directly to cells. When capillary flow slows down in a region, the fluid that normally passes in and out of cells starts to pool in the spaces between them. This creates what clinicians call subclinical edema, hidden fluid retention that you cannot see clearly from the outside, but that quietly adds weight and puffiness to the tissue. Gravity then does its part. That fluid-laden, fibrotic, poorly circulated tissue begins to sag. And there it is, the hang that greets you every time you wave. Here is the most important thing I want you to understand before we get to the protocol. This is not a fat problem. If it were simply excess fat, targeted fat loss would fix it. But targeted fat loss does not exist in any scientifically verified form. No cream, no device, no body wrap removes fat from a specific spot. What we are actually treating is stagnant fluid adherent tissue layers and a muscle that has been chronically under-recruited. Once you address those three things correctly, the tissue tightens. Not because you burned something away, but because you restored the biology that keeps it firm. The first step in this clinical protocol is manual pinch massage. Self-administered, and I will warn you in advance, it is not going to feel pleasant, especially the first time. Find the posterior surface of your upper arm, again the backside, and begin taking very small pinches of skin between your fingers. And I mean very small. This is where people make a consistent mistake. When you grab a large fold of tissue, a deep, thick grab, you feel very little discomfort. But when you take a tiny, superficial pinch of just the outermost layers of skin, you will feel a sharp, unpleasant sensation almost immediately. That pain is not random. It is clinically meaningful. It tells you exactly where the layers have become adherent, stuck together, and where circulation has been absent for a long time. The discomfort is directly proportional to the degree of stagnation and fibrosis in that zone. What you are doing mechanically with these small pinches is forcing a separation between the skin, the subcutaneous fat layer, and the superficial fascia. You are physically breaking the adhesions, those scar-like connections between layers that should not be fused, and re-establishing the natural gliding planes between them. The moment you do this, capillary blood flow to that area increases sharply. Oxygen rushes in, nutrients flood the tissue, and here is where the real repair begins. The cells that produce collagen, called fibroblasts, become active again. Collagen is the structural protein that gives skin its firmness and elasticity. When fibroblasts receive adequate oxygen and nutrients, they ramp up collagen synthesis. Collagen synthesis simply means the body is manufacturing new high-quality structural protein and laying it into the tissue. That new collagen tightens and firms the skin from within, not artificially, not temporarily, but as a genuine biological repair. Do this pinching daily. You will notice something important over the first 2 to 3 weeks. The pain decreases. Do not take that as a reason to stop. That reduction in pain is your clinical feedback. It means the layers are separating, the fluid is clearing, and the tissue is becoming vascular again, meaning it has an active blood supply. Keep going. If you have a willing partner, a spouse, a family member, there is a more powerful variation of this technique. Your partner takes the skin of your posterior arm and rolls it in a wave motion along the surface, lifting it into a fold and pushing that fold along the skin. This is a technique used in manual therapy called skin rolling. On a healthy mobile back, this can actually feel quite relaxing. On a posterior arm with years of stagnation and adhesions, it will feel deeply unpleasant, almost brutal if we're being honest. That reaction is entirely expected and entirely correct. It confirms how much work needs to be done. With consistent repetition over days and weeks, the discomfort diminishes sharply. Each session will feel more tolerable than the last, and you will see visible changes in skin texture and tone as a direct result. Now, the second element of this protocol addresses the muscle itself. The triceps, the extensor muscle on the back of the upper arm, is chronically underloaded in most people's daily activity. When a muscle is underloaded for a long time, its tone drops. Muscle tone refers to the baseline level of tension a muscle holds even at rest. Low-tone muscle is soft, poorly perfused, meaning it has weak blood flow and it provides almost no structural support to the overlying skin. Your skin needs that muscular support underneath it. Without it, even healthy skin will begin to sag simply because there's nothing firm supporting it from below. The most effective evidence-supported exercise for isolated triceps activation is the narrow grip push-up. The key technical detail is this. Keep your elbows pinned close to your rib cage throughout the movement. Wide elbow push-ups shift the load to the chest and shoulders. Elbows tight to the body puts the demand directly on the triceps. If you have not been active recently and a standard floor push-up is too difficult, do not force it. Start by pushing against a wall at a slight forward lean. That is a legitimate exercise, not a cop-out. It places genuine progressive load on the triceps at a manageable resistance. From there, progress to a windowsill, then a sturdy chair, then the floor. Each stage builds the tissue progressively, which is the only scientifically sound way to strengthen a muscle. Progressive overload, gradually increasing the demand placed on the muscle over time, is the foundation of every evidence-based strength protocol that exists. As muscle tone in the triceps improves, blood flow to the entire posterior arm improves with it. The muscle begins pulling the overlying tissue tighter from the inside. Combined with the manual work you are doing on the surface layers, the effect compounds quickly. The third element is stretching, and this is not optional filler. Evidence-based exercise medicine is clear on this. Optimal muscle conditioning requires a 3-phase sequence. Phase 1 is pre-stretch. You lengthen the muscle before loading it. Phase 2 is the strength work. Phase 3 is post-stretch. You lengthen the muscle again after loading it. This sequence matters because the blood vessels supplying a muscle work most efficiently when the tissue alternates between tension and length. Stretching after exercise accelerates the removal of metabolic waste products, the byproducts of muscle contraction that cause soreness and slow recovery. It also enhances delivery of nutrients to recovering fibers. The result is faster, more complete adaptation. To stretch the triceps properly, raise one arm and bend it so your hand drops behind your head. With your opposite hand, gently pull your elbow sideways and slightly backward. You will feel a pull along the back and outer surface of the upper arm. That is the triceps and its surrounding fascia under controlled tension. Hold that position for 20 to 30 seconds. If you simultaneously lean your torso sideways while doing this, you extend the stretch into the lateral muscles of the back and the side of the trunk. A useful bonus that requires no extra time. I need to say something important here because 15 years of clinical practice has taught me that someone will push too hard and injure themselves. The shoulder is a complex joint. It has a wider range of motion than any other joint in the human body, and that mobility comes at a price. It is also the most unstable joint we have, and it is vulnerable. If you have a history of shoulder injury, a dislocation, a rotator cuff tear, chronic impingement, do not push through pain during these stretches. Pain in a previously injured joint is not weakness to be overcome. It is a warning signal with clinical validity. Stretching through active shoulder pain in a compromised joint can cause real structural damage that takes months to repair. If your shoulder has a long-standing problem that limits your daily life, that needs proper clinical evaluation, a physical examination, imaging if indicated, and a structured rehabilitation plan. The fourth technique in this protocol uses arm swings. And the mechanism here is different from everything else we have discussed. This is not static force. This is inertia-based loading. You swing the arm with enough speed and momentum that at the end of the arc, the tissue gets a brief, powerful stretch that static positioning cannot replicate. When the arm whips through the swing, the triceps and fascia are pulled to a length they simply cannot reach under normal controlled movement. That extreme end-range stretch, combined with the small muscular effort needed to decelerate the swing, creates a unique dual stimulus. Simultaneous deep tissue stretch and low-level strength loading occurring in the same movement. This kind of combined stimulus is highly efficient for improving both tissue mobility and muscular tone, which is exactly why sports medicine uses it in rehabilitation protocols. Now, I need to address something that goes far beyond your arms. Your body is one integrated system. Sagging skin on the arms does not develop in isolation. When the connective tissue in one area begins breaking down, it is almost never confined to that area. In my clinical experience, patients who present with posterior arm laxity, that is the loose skin we have been discussing, frequently also show early changes in the jawline and neck, the abdominal wall, and sometimes the veins of the lower legs. In more advanced cases, hernias can develop. A hernia is a protrusion of internal tissue through a weakened structural wall in the body. All of these manifestations have a common root: systemic weakening of collagen and connective tissue throughout the body. One of the most underappreciated drivers of that systemic weakening is vitamin D deficiency. Vitamin D is not just a nutrient for bone health. It plays a direct regulatory role in collagen synthesis at the cellular level. Vitamin D acts on fibroblast receptors, the same cells that produce collagen, and upregulates their activity. Upregulate simply means to increase the output and function of a cellular process. When vitamin D levels in the blood are low, fibroblast activity is suppressed, collagen production slows, and the structural integrity of connective tissue throughout the body gradually declines. Vitamin D deficiency is extraordinarily common. Studies across multiple countries consistently estimate that between 40 and 80% of adults have insufficient blood levels, depending on geography and skin pigmentation. The populations at highest risk are those who spend little time outdoors, those who live at northern latitudes, older adults, and people with darker skin tones. The connection between vitamin D, collagen, and skin laxity is not a fringe claim. It is supported by peer-reviewed biochemistry. Correcting a vitamin D deficiency does not just improve one symptom. It improves tissue repair capacity across the entire body simultaneously. That means tighter skin, stronger ligaments, better joint stability, healthier blood vessel walls, and improved immune function. All from addressing a single, easily correctable nutritional deficiency. Before you supplement, get your blood level tested. The test is called a 25-hydroxy-vitamin D, written as 25-OHD, and it is a standard blood panel item. Optimal levels for tissue health are generally considered to be between 50 and 80 nanograms per milliliter. If you are below that range, work with your doctor on an appropriate supplementation dose. Do not guess and do not self-prescribe a megadose. There is a safe range, and staying in it matters. Here is something worth thinking about as you consider all of this. The risk profile for sagging skin, collagen loss, and vitamin D deficiency changes significantly with age. After 40, collagen production naturally begins declining. The rate of new collagen synthesis drops while the breakdown of existing collagen continues. After 50, the visible consequences of that shift accelerate noticeably. The body simply cannot keep up with the maintenance demand the way it could at 30. How old are you? Leave your age in the comments. I want to see where most of our viewers are in this process because the urgency of starting this protocol is genuinely different at 35 versus 55, and I want to make sure I'm making videos that speak to where you actually are. Here is your takeaway: clean, simple, and actionable. This is a 3-part daily protocol. Manual pinch work on the posterior arm for 5 minutes to break adhesions and stimulate collagen. Narrow grip push-ups progressing through whatever level your current fitness allows. And a proper stretch sequence before and after every push-up session. Add arm swings as a warm-up tool. Get your vitamin D level checked and correct a deficiency if one exists. That is it. No expensive equipment, no clinic visits for healthy people, no creams. Just 5 to 10 minutes a day applied consistently, and the biology of your body will do the rest because that is what your body is designed to do when you give it the right input. I'm Sam Waterling, and I've spent 15 years watching patients waste money on treatments that target the appearance of a problem while the actual cause keeps getting worse. The skin on your arms is not your enemy. It is a messenger. Listen to what it is telling you. Address the root cause, and your whole body benefits, not just your arms. No one sitting in a white coat in a clinic office is going to walk you through this. There is no billing code for 5 minutes of pinching and a push-up progression. The healthcare system generates revenue from visits, procedures, and prescriptions, not from patients who solve their problems at home with correct information. That is why I made this video. Subscribe to Dr. Jason Fung and hit like. Every subscriber moves us closer to 100,000, and every one of you who shares this is helping someone else get the real answer instead of an expensive one.